I will go ahead and get started. I am TeAsia, and I'm going to be our facilitator slash moderator slash one of our presenters today for our Everything in My Basket session. Before we get started, I just want to let it be known that you will have the opportunity to ask questions at the end of this session. There's a chat box as well as a Q&A at the bottom of your screen where you can ask questions. And just keep in mind that we cannot see you if you are live with us today. So just be sure to interact with us through that Q&A and chat box. But without any further ado, I'm going to let Yolanda go ahead and explain the theme of our presentation before we get started today.
Hello, everyone, and welcome. I am Yolanda, and the title for our presentation is Yes, Collaborative Black Health Summit, Everything in My Basket. So, as the Center for African American Health, we are often called upon to present many things that relate to Black health and everything else that relates to Black health and African American individuals and families and groups. We don't always know all of the things that our community wants, and so we're forever gathering things to place in our basket. Sometimes those things are items that we can take care of, and sometimes they may be something we don't know anything about, but we'll figure it out and we'll learn what it is that you want us to know. So today you're being presented with everything that is in our basket currently. So I will turn this back over to TeAsia.
Okay, so we're going to get this started with our very first polling question. So, our first question is, what brings you here today? Are you curious about the information that we are going to share? Did you want to meet us virtually, or are you just interested in learning more about our programs? So, we will give you about a minute or so. Okay, so I want to get this started by just really introducing you to all of us. So, like I mentioned at the start of this, I am TeAsia, and I am our lead family resource navigator. And I joined the CA Health team in December of 2020 just as a community resource navigator. And a little bit about myself and my background. I have a background in higher education, specifically healthcare education, as well as integrative wellness and empowering youth through strength and conditioning, as well as athletics as a whole. And as our lead resource navigator, my role includes collaborating with the FRCA to tailor our services to best meet their standards while also making sure that we are still serving the needs of the community. And in addition to that, I also collaborate with the Mental Health Center of Denver, which allows us to offer cost covered mental health first aid courses through the Mental Health First Aid of Colorado. And then I also help coordinate any special programs and projects that we have, which most recently included our emergency assistance grant, where we were able to serve the community by providing emergency assistance funding as well as COVID-19 vaccinations. And then lastly, as a crisis resource navigator, I maintain our partnership with Elements of Discovery, which serves individuals of color with therapeutic services that are culturally responsive and that can be delivered with compassion. So, to talk a little bit more about our partnership with the Family Resource Center Association, as a Family Resource Center, CAA Health helps individuals and families overcome social, economic, and educational challenges, and it helps parents gain and have access to the skills and resources as well as the knowledge they need to really develop that solid foundation for not only themselves but their children, and really be able to help their families thrive. And for our mental health first aid, as I mentioned earlier, our partnership with the Mental Health Center of Denver allows us to hold ongoing mental health first aid classes. And during these courses, individuals will be able to learn the signs and symptoms of what a mental health challenge or what a mental health crisis looks like, what to do in an emergency, and where to get help for those individuals. And so currently we are offering, we do have two courses scheduled. So our course that is going to be offered on March 23rd is for adults that are looking to assist youth with mental health first aid courses. And then we also have a course on Friday, March 26th, which focuses on adults who would like to assist adults with mental health first aid. So if you'd like more information about either of these courses, please feel free to reach out via our programs team phone number or our email, and I'll be happy to assist you with getting signed up for that process. At the end of our presentation, we will be sharing our contact information. That way, if you are interested, you can reach out and learn more about those two mental health first aid courses. All right, so let's take a quick break. Have another question for you all. So, what is the number one request by community members in the age of COVID? Mortgage and rental assistance, food, mental health, or looking for employment? So I'll give you all about a minute and a half or so to answer that. Okay, thank you all for answering. I'm going to go ahead and pass it over to John.
Okay, good morning, or no, good afternoon, everybody. Um, this is me. My goodness, that's a wonderful looking picture. I am the Community Resource Navigator, and that means I do a lot of talking, I do a lot of outreaching and stuff. And to answer the question about the poll that we just did, you would think mental health and spiritual care would have been the number one requests that are coming through the community, whether it's in person or it's through the crisis line or emails. But the number one request that has come through that I've seen has been mortgage and food. People are asking for help paying their rent. People are asking for uh, food. And then the number three is mental health and spiritual support. Some people aren't interested in mental health, but they would like to talk to a minister or someone in the clergy. And the number fourth was jobs. So those were some of the things that have come out from this age of COVID. Also, my role is a crisis resource navigation. And what that means is that when people call into our center, they're generally in crisis, they have some kind of emotional thing going on, or they're emotional because of what's happening. And my role is to talk to them, to spend some time with them if I can, and then channel them in the right directions to get the support that they need. Next slide, please. Crisis resource navigation. I won't read this because it is in your packets and you can get this, but there is contact information on there on how to get in touch with me. If you dial the 720 number, 780-5919, you can leave a message, or community members can leave a message asking for where to get food or where to get rental assistance and things like that. And we keep a wheelhouse of a directory of current resources and things that we can share with people and helping them navigate the system. There's a lot of stuff out there right now, but it changes really, really quick, especially with some of the testing sites that are coming up and the COVID-19 vaccines that are coming up. Things are popping up all over the place where people can get shots if they're interested or get tested, and they are changing basically on a daily basis. Next slide. Crisis resource navigation continued. The CCP, or the Crisis Counseling Program, is a part of CDPHE, the Colorado Department of Health and Environment, and it's overseen by the federal government. And this came about because during crisis situations, normally like floods or fires or something, people need someone to talk to, or they need to know where to go for resources. And most of the things like floods or the fires that we get are never usually as long as a year. Well, when COVID first came out, the crisis resource came out to help people navigate the system and find out where to go to get care and things like that. We're in a year into it about now. So this has been a little longer than our forest fires, but there is a list here of places that people can call and contact. And it's just not here in the Metro Denver area, but as you look at this, you can see that it pretty well covers all of Colorado, rural and urban areas. Next slide. Okay, here's a poll. The Crisis Resource Navigation Program is designed in the following ways. Which, in your opinion, is the most important? The winner of this will get a Tesla. Not really. Take all the time you need in the next 30 seconds to answer it. Okay, let's see what people said. To disseminate and to support. It's a trick question. All of them is most important. First of all, we need to connect with people, and they need to know that we're there for them. There's a saying in the African-American community that people don't care how much you know till they know how much you care. And once they know that you connect with them, then they're interested in receiving the information and the support and taking what you give them and sharing it with other people. I consider us a overflow agency, meaning if something comes to me and it's something that I can share with other people, I make sure that other folks in the community, inside and outside the community, have that information also. So the correct answer is all of the above. Next slide. And this is one of our community outreach efforts. The tall person in the mask, I have no idea who that is, but the woman standing next to him is Miss Yolanda, who will be talking here in a minute. And the picture over to the right is not me selling anything, but me giving out swag bags. And in those swag bags, there is PPE, masks, gloves, hand sanitizer, information about the center and some of the programs that we have. As of right now, we have been doing pop-up vaccine clinics, and we have been doing testing for COVID, and we have been doing flu shots, and we have been giving out food. So there's a lot been going on, even though we've done it behind masks and keeping social distancing. So Be sure and go to our webpage to find out what's going on, or see us on Facebook, because things change almost daily. Next slide. And this is Miss Yolanda.
So hello, everyone. As the Senior Living Health and Wellness Navigator, there are a plethora of programs that I am involved with. And what I really like to say is that I am ever reminded of Jill Scott and her song, Living Your Life Like It's Golden. So each one of my senior programs is designed to help those of us live our life like it's golden, those of us that are 50 and moving forward. So under that umbrella, I am working with Tri-County Health as a co-facilitator in our Journey to Wellness program and our Diabetes Self-Management Education program. Aging Mastery has probably been one of the best highlights that I have had the occasion to work with, and that is through the National Council on Aging. And then Hypertension in Me is another program in which we are really looking at one of the health risk factors that happen within the Black and African American community, and that is hypertension, or more commonly known as high blood pressure. And we do that through the American Heart Association. With our faith and health liaisons, I have learned so much about what a gift it is when community comes together. And those faith and health liaisons work in conjunction with their faith leaders to create health ministries within and amongst their own faith communities. Next, please. Polling question number 4. What is your age group? Remember, it's confidential. Okay, so whether you created an age to be, have desired what you want to be, here are our results. Thank you. Next. So I want to explain a little more detail around Journey to Wellness. On this slide, you will see pictures of participants as well as presenters within the Journey to Wellness program. This slide is a picture of a group that we worked with, Theater Artibus, who presented their recipe program to us. So it was a way of being able to engage our participants in something that had to do with mental well-being, but also helped us to be directed on our journey. So Journey to Wellness is a lifestyle change program that this particular class is a year-long program. We meet once a week, and really we're concentrating on sustainable life changes. How many times have you said, oh, Monday, I'm going to get on a diet and I'm going to lose 32 pounds by Wednesday, only to find that on Tuesday, you just weren't really feeling that weight loss program. And then it just fell by the wayside. So Journey to Wellness is a way for us to look at being healthy at any weight and being able to move through and address whatever health topics that we have. So with Recipe, it was a way of being able to put that in perspective, to have fun with it. Many of our participants in our senior programming are not only from Colorado, but represent other states as well as the U.S. territories. Next slide, please. Aging Mastery. This is the National Council on Aging's Aging Mastery Program, which helps us as we age to learn how to age. Nobody ever teaches us how to grow old. Some of us think that we hit some magical, mystical age and we're supposed to stop doing all the things we've ever done. Well, that is so not the case. Aging mastery helps us to look at things that we may have looked at differently, with respect to exercise, with respect to our medication management. How are we going to engage within our community? And also financially, what are those things we need to do as we move forward? How do we plan for our future? And how do we leave information for our families to begin to plan? How are we modeling what it looks like to live our lives like they're golden? This class meets every Thursday from 12 to 1:30, and we have a rolling enrollment. So if you're interested, make sure you reach out. Next, please. Poll number 5. Did the Faith and Health Ministries and Liaisons exist prior to COVID-19? Take a wild guess, even if you don't know what a faith and health ministry is or what a faith and health liaison is. Are we ready with the results? Absolutely. They did exist prior to COVID-19, and they have been a wealth of knowledge. They've been a way of connecting to their own individual communities. So through this, we have an active faith and health ministry, which I call my Tea Party group, because when we meet at our virtual quarterly meetings, they are designed and entitled as the Virtual Tea Party. We actually have tea, of course, virtually, and everyone is able to bring whatever they would drink with their tea as we meet and we discuss what do we think we need to have within our church families. How are we best going to reach out to help them, the individuals within our faith ministries and families? How are we going to help keep them uh, healthy during this time of COVID? One of the things that we know is that many of our elders have been isolated, have been so isolated that all they want is just someone to reach out and touch, to be able to say, hey, how are you doing? Did you see such and so on the news? Just to give them an opportunity to connect. So our faith and health liaisons have been providing this, as well as setting up community COVID vaccine sites and COVID-19 just informational sites. They're also good at providing food giveaways and clothing giveaways. Thank you. And next. Diabetes self-management education. While this has been labeled and created in our senior offering of courses, diabetes can happen at any age. And we're looking to create an intergenerational education program. But right now, we have the diabetes self-management education, which I had stated earlier, we do in conjunction with Tri-County Health. This is an 8-week course offered in partnership. And what we do is have 4 weeks of in-person Zoom education right now, and then you get 4 weeks of individual consultation. We will be beginning our next series of diabetes self-management education in March, and reach out. You've got my contact information. Just send me an email, and we will let you know when our start date is. But we will be starting in March. Next. Hypertension in me. So this is one of my favorite programs. It really, from a very personal standpoint, it really got me into the habit of making sure that I was checking my own blood pressure, monitoring it at least once a day, even though I tell everyone we really need to be doing it twice a day. I can at least be good and remember, because sometimes I was doing it once every 3 or 4 weeks, sometimes not at all. And I have found that it's so much better to know where I am with my blood pressure than to guess about where I think I might be. This 8-week course is designed pretty much like the diabetes education program. We have 4 Zoom sessions and then 4 one-on-one check-in sessions. With this particular program, we don't want anyone to say, oh, I can't do it because I don't have anything to monitor my blood pressure. So we make sure that you receive a blood pressure cuff to help you uh, do your twice daily blood pressure readings. We opened registration in January. We've had a class that began on Monday. It's not too late to enroll, so just reach out and let us know. Next.
Okay, so I'm gonna shift and talk a little bit about the other programs that we offer here at CAA Health. So the first program that we offer is Be Heard Mile High, and John, I'm gonna let you just talk a little bit about that.
Okay. Um, Be Heard Mile High is a leadership advocacy program that trains African American community members to identify and advocate for change in health policy to create equity in the areas that they care about. Eric Moore is our person who leads that program, and they're having an offering today at 3:30 at 3. So if you're interested in finding out more about it, be sure and get on to that. And Eric will explain everything and all things that have to do with Be Heard Mile High.
Thanks, John. So the next program that we offer is Strengthening Families. Strengthening Families is actually an evidence-based course, which is nationally and internationally recognized. And it focuses on really just helping families attain skills. And they go through a training program with their children, sorry, from birth to 5 years of age, and really just focus on enhancing their family skills, their parenting skills, and just strengthening their families overall.
Okay. And I will take on Learning to Live Well. Learning to Live Well helps each one of us know all of the different aspects of health insurance coverage. And the enrollment period was extended. So for those of you that don't have insurance, are thinking about changing insurance, wanting to know more about your health insurance coverage, wanting to know more about cost, while we are not insurance brokers, you can reach out and make an appointment and have a virtual session to find out more just about what health insurance is and what it covers, because sometimes you read that information and it can be so daunting that you just give up and say, well, I'll just take whatever is offered. So we want to make sure that you are receiving all of the information, accurate information, and being able to make, for lack of a better word, a good healthy choice. Okay.
All right, so the next program that we offer, we currently have a program going on for utility bill assistance, and this is in partnership with Energy Outreach Colorado, as well as I cannot talk today, Aurora Water. And so we can provide utility bill payment assistance to households that are in the Metro Denver area and are at the risk of having their utilities shut off. So if you know anyone who is in need of this, definitely share this information with them. We do also have a flyer for this that we can send out if this is something that you're interested in learning more about, or you know someone who could benefit from this at this time. And like I mentioned earlier, we will have our contact information shown at the end of the presentation. That way you are able to reach out for additional information. And with that program, just keep in mind that it'll only be offered as we still have funds available. And then our very last program that we offer is our Workforce Readiness Program. And this is supported by a grant that we've received from the Denver Economic Development and Opportunity um, division. And so, with our Workforce Readiness Program, it provides teenagers as well as adults with the support that they need to be able to find their next job. So, that includes things like cover letters, resume, and really just having those skills to get out there and begin interviewing and applying for those jobs that you're looking for. And for the Workforce Readiness Program, the same as all the other programs, our contact information will be listed. That way, you can reach out to us if you have additional questions and if you are interested in joining that program. All right, so this next question that we have, we really just want to get an idea of the area that you live in. So if you live in any of the counties that are listed on the screen, definitely feel free to check that. Or if you live somewhere else that is not located in one of these counties, please feel free to drop that into the chat as well. Okay, awesome. So I saw one other come through. Would you be willing to share in the chat which area that you're located in, which county? And if not, that's okay too. Okay. All right. So one last thing that we'd like to share with you all, we do have some open positions. So if anything that we shared is appealing to you, or if you know anyone who could fit these positions, definitely send them our way. We currently have positions open for a community resource navigator. We are looking to hire a strengthening families program group leader, early childhood education program coordinator, a behavioral health navigator, as well as a workforce development specialist. So if you know someone who is interested, or if you are interested, you can apply by submitting your cover letter, resume, and a writing sample to our careers at caahealth.org email. We don't take any phone calls, so all of those applications do have to be submitted electronically, and we also do not accept those in person. And if you'd like to know more information about the specific positions, I'd encourage you to head over to our website as well, as all of that information will be listed there. Um, and you can also take a screenshot of the information that's displayed on the screen. That way you remember, or we do also have a PDF version of our presentation today that is listed on the Whova app, so you can download that as well. Okay. And we just want to go ahead and open it up for questions. So if you have any questions, like mentioned at the beginning of our presentation, we do have both the chat box, or you can use the Q&A to ask those questions, and all three of us will go ahead and answer them as they come in. Okay, so our first question, which of our program offerings have we heard the most productive feedback on during the pandemic? So I think that we all serve a variety of communities here. I think we could all probably speak to this. Yolanda, you hold a majority of the program. So do you want to talk about which one of your programs has had the most positive feedback during this time?
Certainly. So I think it would be a toss up. Um, just in terms of individual lifestyle changing and support, um, one that I hear often from our participants um, in our journey to wellness is just about how the individual participants have become like family, and how they are individually they're trying to make these lifestyle changes, but they also hear the support that they get from others. They really, really like that. So in Journey to Wellness, we kicked off this 2021 year with a virtual dance party, and we had a live DJ. We do step challenges, and our senior member of that program, of that group, is 70 plus. And in our last challenge, which was 30 days long, she did almost a 500,000 steps. So for someone who just wasn't doing that at all, she's won all three challenges that we've had, and she's always ever amazed at how she wins those challenges. In our aging mastery program, we had individuals from the U.S. territories and from Palm Springs, and our person from Palm Springs put it on her Facebook and just kept telling everybody they ought to reach out and join. So she just talked so much about how it just changed her life. In fact, she went on this healing journey, changed how she ate, changed how she exercised, and is really just living it up out there in Palm Springs. And then with our hypertension, we had some people that were having some physical difficulties and didn't think that they could be on a Zoom chat. And they were just so amazed at how they were able to incorporate the Zoom chat, and basically said, if I had been in a classroom, I wouldn't be able to do this. So I think that we do really great work. And the reason we're doing such great work with our senior programs is because I have a group of amazing seniors who are allowing themselves to be the best, do the best, and have the best that life has to offer. So I'll turn it over to you, John.
Thanks. I'm going to claim under my umbrella the vaccine clinics. We are doing vaccine clinics, and people want to come to the center to have them done because they trust the center and they trust the work that's being done, and they like the idea that we're there for them. In fact, people call in and ask when we're doing the next one because they want to show up at our front door. And there's conversation that happens. There's people sharing information with one another. And there's a sense of community, once again, that has not happened in almost a year due to the pandemic. So I'm going to say the outreach that we do at the vaccine clinic. Um, Hopefully, we won't be doing that next year at this time. But as of right now, I would say that's a big thing that we're getting positive feedback from.
Thanks, John. And
Mhm.
I will conclude that question with talking a little bit about our last special project that I mentioned earlier in the presentation, which was our COVID-19 emergency assistance grant that we received. Through that grant, we were able to serve over 100 families by providing assistance in the form of 100 to $500 based on their specific need. So it was a little bit but for so many right now who are struggling, it was really helpful and beneficial. And we were able to serve them by providing grocery assistance, rental assistance. Some individuals needed resources for mental health crises, whether it be for them, because they're parents and they have to be at home during this time. With some of them had 7 kids, that takes a lot on your mental health. It takes a lot on your children's mental health. So we were able to serve them that way. We were also able to provide resources to individuals who have newborns and needed assistance with clothing, formula, those type of things. And some people, because they were unemployed, they looked to start their own business. So we were also able to provide resources and funds for different things like that. And because we were able to help so many people that way, we also were able to get people to continue coming back and enroll in some of our other programs, like Yolanda's programs, or maybe they needed more assistance with utilities right now. We were able to refer them and get them that assistance that they need. So I would say we were able to touch so many people in different ways. I don't think there's really one umbrella that fits under the most positive feedback, because it's everyone has something different that they needed during this time. So for those who were able to get the help that they need, it really impacted them and it was a positive impact for them. So I hope that that helped to answer your question.
Okay. There was also a mention in the Q&A with respect to colorectal cancer. And as I said at the beginning, we have a lot of things that have been put in our basket. So some of which we are actively working on, and others, such as the colorectal cancer, any prostate health collaboratives, anything of that nature. We are working on those, but we're not at a point where we're ready to acknowledge, hey, yes, this is what we're doing. Come to the Center for African American Health to get this.
Okay, what other questions do we have? Okay, if there are no additional questions, or I know questions always come up last minute, at least for myself, so feel free to reach out to any of us. Just for more information about our programs and services, you can contact us via phone, which our phone number is 720-780-5619. Or you can email us at connect@caahealth.org. And as we begin to wrap up this session, if you enjoyed it, or if you felt that you got information that could be valuable for yourself or to share with others, definitely be sure to give the session a like through Hoover if you're on the website platform. Or if you're joining us through the app, you can also give a 3-star rating as well, whichever works easier for you. And if anyone has any final questions, feel free to send them through to us. Okay, well, we thank everyone for joining our session today, and I hope that you have a great rest of your Saturday wherever you are at.